Hello and welcome to the Queen Elizabeth Patient Podcast. We'll have today with us is Sister Pauline Connolly. She's a breast care nurse at Queen Elizabeth Hospital, and she's been a breast care nurse now for over 17 years, so has got many years of knowledge and experience of working with patients diagnosed with cancer. But the reason Pauline's come today is to give us some more information about ladies once they've received the results from their surgery or have been given a diagnosis about treatments such as chemotherapy. So Pauline, welcome today. So if we could just touch upon what generally happens when a lady comes for the results after a surgery and is given the news that possibly she may need chemotherapy.
Hi Caroline, thanks for the invite. So ladies always are told from day one, if they have their operation first, it will take that couple of weeks for everything to be processed by our doctors in the labs to give us all the information about their cancer. So the treatment's very specific for each lady. So depending on the type of cancer, the size of cancer, the receptors on the lady's cancers, this will all go towards whether a lady will benefit from chemotherapy. As you say, most ladies will have their chemotherapy after surgery. One of the new things we have available in the NHS is a test called Oncotype DX. A lady doesn't have to do anything about this test. It would be automatically performed for that lady's cancer once the operation's been done. And if that cancer fits the criteria, it's automatically sent over to the United States, where we perform special gene tests, and that allows the team, mainly the oncology doctors who are the experts in chemotherapy, to help decide whether that lady in her particular cancer would benefit from chemotherapy. So we should have that information, or whether the lady's actually had the test done with a surgeon. So she'll come in with obviously a family member. The surgeon will then tell her, first of all, is the surgery complete? Usually it is, and then whether she's going to need chemotherapy. So the majority of ladies will have their chemotherapy as a preventative. The cancer's gone with the surgery, and what we're going to do with the chemotherapy is to help prevent the cancer from coming back. Most ladies will also need the radiotherapy, but we always do chemotherapy before radiotherapy, and we then refer our ladies onto the oncology team.
And so when a lady's referred on for oncology, do they always get that at the Queen Elizabeth or the host hospital that they've had the surgery at?
What happens, Caroline, a very good question, by the way. All of the oncologists in the region are based at the Newcastle NCCC, and each local hospital, such as the Queen Elizabeth, Durham, South Tyneside and Sunderland, have an oncologist who goes out to their local hospital at least once a week and does a breast clinic there. And it's usually much more convenient for the patient and safer if there was any problems to have your chemotherapy at your local hospital. So the appointment is arranged with the oncologists, and the oncology doctor will talk through the findings from the histology, which is all about the lady's cancer. They should have the special test results for the oncotype with them at the consultation for those ladies who've had that test done. And if they decide to go ahead with the chemotherapy, it's explained that 99% of the what you call adjuvant chemotherapy, that's something that's given to prevent something from happening in the future, which is hopefully prevent a cancer from coming back. That chemotherapy is given IV, which means it's given by a little venflon, which is kind of a needle in the back of the hand, and that treatment is given into the body, and it then treats the whole body.
So when I've been and I've saw the oncologist and they've recommended that I need chemotherapy, what would you think, what would generally happens after that? And from a time scale point of view, generally, what would happen?
Generally, under normal circumstances, when we haven't got the COVID interrupting the hospital appointment system, most ladies will be seen then by their chemotherapy staff. They'll have an appointment to have a look around the chemotherapy unit. They'll have a booklet of information, contact numbers, and that's usually within a maximum of 6 weeks. They will be seen and have their first treatment.
Because one of the things as well is it can be a long wait, because again, one of the purposes of waiting so long between treatments, am I not wrong, but is obviously there's a lot of healing to do after surgery. And we also use this time to maybe, would you encourage patients to try and maybe get a little bit fitter, think about some of the foods that they're eating, and maybe just make sure that they're in tip-top condition? Because it can be quite a grueling regime, I can imagine.
You've hit the nail on the head. So it can be nervy waiting for your chemo to start. However, what you've got to remember is the cancer has gone. In this adjuvant setting, what we are doing is we are giving chemotherapy to help prevent a cancer from coming back. And that few weeks that your body needs to totally heal your wound, because if your wound isn't healed, we couldn't start the chemo anyway. But if you can get yourself at your optimum fitness, like you say, have a regular exercise routine, even if that just involves a 20-minute walk every day, you're going to get yourself in the best shape to endure the treatment. Like you say, the diet, it doesn't have to be a special diet, as long as you are following the government guidelines and having your fruit, your vegetables, your lean meats, low-fat diet. Everybody's allowed a treat, but obviously we don't want to do things in excess. And if that can be established before the chemotherapy actually starts, you're halfway there to help and prevent dealing with the fatigue.
Yeah, and I think as well is obviously, I think probably if we ask patients about being the worst side effect of chemotherapy is sometimes the fatigue. And I don't know about you, but patients have said the less they do, the less they want to do. So I suppose that's why it's so important to keep that fitness up, so that when they get to the end of the treatment, they're not in such a bad state that they can't try and get back to some form of normality.
That's right. We know there's actually lots of evidence, international evidence, that shows that if you maintain some level of fitness, and even if it's walking, we don't expect people to go to the gym. In fact, we don't want people to go to the gym during the chemotherapy. But if they can even just walk 20 minutes, and if you can do a little bit more every day during your chemotherapy, even if you feel washed out, and there'll be some days during the process of chemotherapy where you will feel really tired, you might end up sleeping, several hours during the day, but at some point, even if you walk around the block, get some fresh air, stretch your legs, we all know that contributes to a quicker recovery, and also it's vital for mental health.
Yeah, just to go back a little bit, so when they come along to that first appointment, Pauline, and they meet their oncologist nurse, can you tell us just a little bit more about that very first appointment when they come for their first chemotherapy?
The actual appointment in outpatients, they will see the medical team. So they'll either see their consultant or their registrar, where each patient has been discussed in the MDT, and the consultant will discuss with the registrar prior to the patient's appointment exactly what treatment's recommended. On occasions, there may be a breast nursing clinic, but unfortunately, because the surgical side of the department is so busy, not everybody is seen by a breast nurse in their chemotherapy appointments in the outpatients. But once the doctor has seen the patient, they've confirmed which chemotherapy that they're going to have, and it's usually, so most ladies have 6 cycles of chemotherapy. Sometimes usually it's every 3 weeks. However, this may differ depending on a particular lady and her own circumstances. And there's an addition sometimes of a drug called Herceptin and a sister drug called pertuzumab. However, there is a separate podcast going into more detail with these drugs, because there's only approximately a quarter of ladies will benefit from these drugs.
So, Pauline, if I'm right thinking, if I was maybe having the 6 cycles, so that's approximately 18 weeks, but some ladies on some cycles things like white cell count might be a little bit low. What would happen then if maybe my white cell count was a little bit low?
Part of your treatment, once you've seen the consultant, you get referred down to your local chemo unit. The girls in the unit, they're all very friendly. People get quite surprised that they hear laughter in the chemo unit. And part of their role is they will request ladies' bloods before they have the next cycle. And this is because chemotherapy is not as targeted as we wish it to be. So it will help prevent any stray cell be eradicated. However, it's not sensitive enough to only kill off cells that are bad. It unfortunately can damage very good cells. And one of the cells it does damage is the white cells in your body, and they are needed for infection. So the chemotherapy girls will check your white cell count before your chemotherapy. And on occasions, as you say, Caroline, they can drop, and we need to make sure that the white cell count is at a safe level before you then have your next chemotherapy cycle. Some ladies will have their chemotherapy delayed a week or so until the white cell comes back up to a safe level, so we aren't doing more harm, making somebody susceptible to infection whilst on the chemotherapy. So this is why we say, although you will be given all of your dates for your chemotherapy at the start of your treatment, we wouldn't say book a holiday at the end just in case your treatment goes on a bit longer. You've got to remember that the radiotherapy treatment is needed most of the time after the operation, and this will not usually start until approximately 4 weeks after your last chemotherapy. So we need to factor those treatments in before ladies dash off
and book things, because
Yes.
I think, people with busy lives and families and things like that, we kind of like to plan things, and I think that's the disappointment, is the expectation is, and it needs to be completed then, because I maybe have told work that I'm back at this particular point. And I think, I don't know, in your experience, Pauline, is just to overestimate everything. And if anything kind of falls before that, then that's fine. But I think there's that panic and worry that things aren't going to be finished in time if maybe they've got plans with work and return and things like that as well.
That's a very important point, and also it has an impact on finances. So ladies often are worrying that they're going to run out of sick money. So as soon as you can, speak to your employer and let them know they're going to need it's usually at least 7 months off work if they can. I know some ladies do work through the chemotherapy because they actually can't afford to stay off. They don't get a sick pay, and we worry more about these ladies because they are more susceptible to infection. They do suffer from fatigue, and in the long run actually take longer to recover.
Yeah, because my worry in the current circumstances is that, a lot more people are working from home. So a lot of people might feel that they have to work during chemotherapy because they are technically at home. But again, what you mentioned there is the fatigue. And I think it still takes a lot of energy when you're at work, although you might be at home, but you need to reserve that energy for your treatment. So I think, again, it's just a warning to patients, I think, that they can maybe work from home, is just to be very careful with saying that employees. Would you agree with some of that?
Totally. I think what people need to have is as little pressure on them as possible. And what a lot of ladies find is it's an accumulation effect. So after each cycle of chemotherapy, you tend to get more tired. And I think what some ladies also forget is they are still recovering from the surgery. So although initially they may feel very fit and well and surprised how well they are feeling, they've still got to heal the wound. They're recovering from a general anaesthetic. And we introduce chemotherapy to their bodies. The fatigue can then come back in quite quickly after, say, 2 or 3 cycles. And what we often advise is you just don't use your alarm clock. If you've got nowhere to go, so if you don't have an appointment at your hospital, try just to sleep in until you wake up. Some ladies say, listen, I've woke up at 6:30 every year since I've been an adult, and that's what I do. So for those ladies, say, well, actually, you might need a little nap, whether it's after 11 o'clock cup of tea or after lunch. You need to allow yourself time just to rest and do nothing. And when I say do nothing, I mean physically walking around, hoovering or polishing, because your body is always working. So even sitting watching the television, your body is working really, really hard. And this is why we say the benefits of not working at all and having the pressure of even working at home. If we can eradicate that from your treatment time, it just takes that one extra bit of stress away from you. And then reducing stress obviously then helps your body recover quicker.
Yeah, and I think as well as, Pauline, I don't know if you want to explain that, I think people presume that chemotherapy, in that maybe 18, 20 weeks of receiving treatment, that they may feel poorly during that whole time. But it's very much a sort of peak and trough of how the symptoms are and how they might feel. So how you're feeling a few days, maybe when you've just received that cycle of chemotherapy, how does that generally symptoms-wise? So if I've been given me chemotherapy today, what would I expect over the next sort of week or so?
Once you've had your first chemotherapy, and we know how you're going to react, because some ladies may feel sick, and on very rare occasion they may actually vomit. That's extremely rare. And what you have to do is you ring your chemotherapy unit, because that are medicines that we give ladies to prevent sickness. So by your second cycle, we're hoping that you're not going to feel sick, you're not going to vomit at all. And ladies actually also get a little dose of steroids to help them through the side effects of the chemotherapy in their first few days. And often ladies say, although they're tired, that little bit of steroid in the body gives them a bit of energy, and they actually get a lot of their housework out of the road. So they can be ironing even when they're tired, and they get into a little pattern where, although they think, I need to go to sleep, but I can't, they'll do a little bit of ironing. But that's the first couple of days. And then once their steroids have sort of settled, and say day 5, 6, then the tiredness may kick in. And then most importantly, you're talking 7 to 10 days after your chemotherapy, you are more susceptible to infection at that point. So you might actually feel okay, but that is the time when you are going to be more vulnerable to an infection. You would want to avoid anybody who has a cold, especially in, obviously, we're talking about COVID at this point and isolation, but even without COVID, you would never go to a swimming pool, for instance, while you're having chemotherapy. So anywhere where there's lots of people and risk of picking up infection, that's 7 to 10 days you would try and avoid. You may feel quite tired at that point. You may feel full of energy. It doesn't give an indication of how your body's able to cope with infection. So we usually say try and kind of stay low key. Try and still have your daily walks and things, but just try and avoid, say, going to see your grandchildren, for instance, if you know somebody's got chickenpox.
Yeah.
But by week 3, so your 21 days, you start to feel a lot better. Your bloods will pick up and you think, oh, I'm getting back to me normal. And then the next treatment's given. And as I mentioned before, sometimes there's an accumulation effect. So you're more tired after cycle 5 than you were after cycle 3. And ladies start to know that by that time, actually, by day, say, 9, I feel much better and I can go and see the girls or do a podcast, or I can have a virtual cup of tea with them. But by your day, say, 16, you meet your friends or the grandchildren and actually go out and not be at risk of infection. So you will get into a little pattern. And then by cycle 6, which most ladies will have 6 cycles, occasionally some ladies will have a few more. And if ladies have allergies, there are certain chemotherapies that you give more often, but it's the same dose in the long term. Their chemotherapy may go on a little bit longer.
So it's just the frequency that'll probably
Yes.
change, but they're
Yes.
still overall getting the same dose as somebody else.
And there's days that are really hard and ladies struggle, but one of the things that really helps to tell us is you've got to remember that cancer's gone. This is to help prevent the cancer from coming back, and we'll give you everything that your type of cancer needs to do that. So the radiotherapy is often given as well, which is the local treatment. So you have your surgery radiotherapy for your local treatment, and you have your chemotherapy, which treats the whole body. And some ladies will also have tablets, which again treats the whole body. So there's lots of ammunition we have to help prevent breast cancer from returning.
Excellent. Thank you very much for coming today, Pauline.
Thanks very much. If there's anything else I can do in future, Sister Tweedy, I'll be happy to come back.